I'm here with Dr. Samir Doshi, who is the medical director in the Pediatric Pavilion in Memorial Hospital in Mount Holly. Now, there's a really innovative model here with the emergency care and the inpatient care. Explain that for us.
About a year ago, we opened what we call the Pediatric Pavilion, which is a hybrid unit. It's a combined emergency and inpatient unit in which we can care for all kids under 18 years of age.
How is this shared model actually improving the continuum of care for the patients that you serve?
We have the same staff, both physicians, nurses, techs, child life, that all will take care of you from start to finish. If you come into our emergency side and you need to be admitted and you're transferred over to the inpatient side, it's the same group of docs, nurses, and other staff will be taking care of you, and so they get to know the patients really well. This provides for less medical errors as well as a better relationship between the hospital staff and the patients.
Do you find that this is also driving down the cost of healthcare?
It certainly does. As I said, the shared model not only includes the staffing resources, but it also is with other resources such as medications and all the supplies that we need. And so, in kind of being able to dynamically move, the resources on either side, it definitely costs less overall to take care of the pediatric patients here.
There are some other innovative partnership applications of the partnership with CHOP and Virtua. Telemedicine is one of them. Tell us about it.
Sure. So actually Virtua is the pilot site for the CHOP telemedicine program. And with this telemedicine robot, we actually have access to certain CHOP subspecialists. For example, we have access to CHOP neurology. And so without the neurologist having to actually come on site, we can wheel this robot into a patient room, and through the computer, we can actually have an interaction between the pediatric neurologist and a family in real time. Not only can the families talk to the neurologist, but actually the neurologist can see the examination through the robot. They can actually hear heart sounds through a stethoscope. They can see the neurologic exam pupillary responses as well. And so it's actually kind of a full consultation done remotely. Families should get the best possible care in their own community. For many of our families, it's a hardship to go into Philadelphia, and so providing some of these services here makes it much easier for them.